Less than 24 hours to go for the mega vaccination drive, which is going to begin at 3,006 centers pan-India. Preparations are on in full swing to ensure a seamless inoculation drive where 1.65 crore doses of the COVID vaccine from Serum Institute and Bharat Biotech have been shipped out to all states. 100 beneficiaries will be vaccinated at each of the sites across the country, and the Prime Minister will virtually launch the vaccine drive and also the CoWIN app, which is a nodal digital platform on which, of course, all the beneficiaries' data and follow-up will be monitored. This will be launched at 10:30 a.m. A maximum of 100 beneficiaries will be given the vaccine shot at each site tomorrow. Well, of course, tomorrow is the big day, the most crucial day in India's mega war against COVID. It's been a long process, but it's been a process which has been backed by our scientists and our medical experts. Remember, first in line for receiving these doses are frontline workers and healthcare workers who have been at the forefront of this war against COVID. There are two vaccines, remember, that have been approved for use, Covishield and Covaxin. Covaxin of Bharat Biotech being in the scrutiny a little because of being given the go-ahead before completing its third phase of trials. But we've had medical experts, we've had the government over and over again saying that these vaccines are entirely safe. There are no serious adverse effects on their usage at all. Now, Avni joins us for more on that. Avni, of course, there are some concerns that people have. There's a lot of misinformation that people have, a lot of doubts and queries that people have. And we at Mirror Now here want to try and answer as many of those questions as possible.
Yes, absolutely, Aarti. And let me take you through some of the most commonly asked questions at this point in time. Starting with the first question that will just come up for you is whether it is mandatory to take the vaccine. The answer is that it is completely voluntary, and the complete schedule is advisable. That is, of course, what that is. In fact, the second question is the vaccine safe as it was tested in a short span of time? Now, the vaccine has received regulatory approval basis safety and efficacy. So, vaccine is safe is what one should be aware about. Does a COVID recovered person need a vaccine? Yes, it is advisable to take it because the immunity will then be stronger. So, it's not as if just because you've had COVID, you automatically have the antibodies and that is going to last you for a long period of time. You have to still take the vaccine. How is the vaccine chosen for administration? Safety, efficacy, data examined, all of that is examined by the drug regulator. That is essentially how the vaccine has been given the nod. The possible side effects from the vaccine, this could be mild fever, pain, but also remember that many vaccines come with these mild side effects, and that may be expected even in this particular case as well. Let's also talk about the next question here is, can a person presently having COVID be vaccinated? So it is recommended that one has to wait until you've recovered, until the symptoms have passed, and then 14 days after that, you can actually go ahead and take the vaccine. Those are some of the basic questions at this point in time, Aarti.
Avni, thanks so much for that. I'm sure that's helpful for all our viewers, and we'll keep doing that. We'll keep answering more of your queries. We'll keep busting some of the myths around the vaccination process as well as we go along. But remember, tomorrow you can tune into our special coverage starting early tomorrow morning as India prepares for the big vaccination day. Meanwhile, the Election Commission has given its nod to share voter details with the Health Ministry to identify the beneficiaries of the vaccine centers tomorrow. The center has in turn assured cyber security of the beneficiaries' data and said it will be deleted soon after the vaccine drive. Now, in Karnataka, as all of India is gearing up, of course, for this big day, in Karnataka, 243 vaccination sites have been set up for the phase 1 tomorrow. Here's a ground report from one of the vaccination centers in Bengaluru's Yelankala Hospital.
Big day for the country tomorrow, as we're going to be seeing vaccinations being administered to, in fact, all our healthcare workers. And much like, of course, the other places right here in Bengaluru as well, we're visiting Ground Zero, a session site, a vaccination session site, wherein we're going to be showing you what the procedure really is like and how our healthcare workers are going to be getting vaccinated tomorrow. So this is the Yelahanka Government Hospital that we're at, and this is going to begin with the healthcare workers first entering the waiting room that we're at, showing one ID proof that's been mentioned over here. This could be any of the ID proofs such as the Aadhaar, the voter ID, the driving license, PAN card, or any government issued identity card. Now, Now, once they have verified their identity over here at the entrance is when they're going to be coming here at the waiting room. They're going to be made to sit down over here with social distancing being maintained, and one by one they're going to be approaching the person that's sitting here. A slip is going to be issued to them, wherein from here they're then going to in fact proceed inside for the vaccination or in the actual vaccination room.